One of my first cases was somebody who came for what is called a smile makeover. She was a 65, 70-year-old, I would say grumpy woman because she wouldn't smile at all. And the reason why she wouldn't smile is because the poor lady had no teeth to show. So this is not related to orthodontics. Orthodontics. This is actually another case that I did, but we actually ended up giving her 25 teeth back, and her picture's still on my board. She wrote the best possible blessings that she could for us, but that smile on her face I could never forget. I'm Dr. Mahima Nanda Kapoor, and I'm an orthodontist. An orthodontist is someone who basically puts braces. Well, these days dentistry is basically seen as a profession per se, but for me it's a little different. I treat it more like a passion for myself because basically you're transforming smiles. Well, BDS is where we start. It starts with a competitive exam that you clear and you end up going to a college. It's a master's that you do after you finished with your bachelor's of dental sciences. So it's a 3-year program that you do right after you finish with your 5-year program of BDS. The formal training is tough. There's a lot of work. You have to really study very hard. You have to be prepared to sacrifice a lot in your life in terms of, having that Delhi University life. You're not going to have it. You're going to be sitting in college. You're going to be mugging up things. You're going to be working without knowing where you're going to land, frankly, because like I said, you're at sea when you get out of college, right? You have to learn to swim all over again. But it's a lot of hard work, and just making sure that your clinical skill is par excellence is the key. Dentistry is a vast subject. When you're in your first 5 years, you're basically looking into BDS, that is your Bachelor's of Dental Sciences, where you get a full roundup of what all dentistry has to offer. So they give you a certain amount of experience in each and every field of dentistry. So you have your basic qualifications in place. Second line of action is when you want to do your masters. Now, when you want to do your masters, you can look at surgery, you can look at orthodontics, prosthodontics, you can look at a certain non-clinical branch, you can go into implantology, which is again a 2-year course at certain colleges now. You can, if you want to go into research, you have avenues open, and basically it's pretty vast. I would advise people to actually go into a niche practice where they can make a name for themselves in a particular branch. If you want to just come out of college and open up a clinic, I would at least advise people to go through an experienced training process. It could be with a college where you have a lot of patients coming in. It could be with a dentist where you learn volumes of work. It could be through a lot of short-term courses, but you have to have all that behind you because that's your armor basically when you're dealing with a patient face to face. Now, when you're dealing with that kind of experience, when you're seeing a patient every 15 minutes to half an hour, it opens up your eyes to a large variety, a large volume of work, and it gives you that one important skill that is primarily for a doctor, that's diagnosis. If your diagnosis isn't clear, you don't know what you're doing, basically. So if you have that under your belt, it's smooth sailing. When you're in education, when you're getting educated, you're in a nice cocoon. It's nice and warm. You suddenly call doctor so and so, so you feel that life is made. We're going to get out there, and there's going to be a line outside my clinic. It doesn't happen. It is a hard process. You have to go through that rigmarole. You have to go through that whole process of waiting for someone to walk inside your door, and not lose your confidence then. Because if you crack, then you'll just feel that I'm in the wrong boat. Because a dentist or an orthodontist, or even if you've done your masters, or even if you're a doctor, you have to wait for people to know you. You have to be patient to get your patients, basically. I think a big challenge for any dentist today is to deal with the sheer volume of dentists. but you have to constantly, upgrade your knowledge. You have to constantly work at your skill, uh, and do something in a way, or run your practice in a way that's different from the rest. So just setting up practice and making your name, waiting for that whole word of mouth thing to spread, because that is the best form of advertisement that you can have for yourself. Also, a very, very hard part of practice is to make sure that each and every case of yours gives you an A plus, because one good patient can probably just get you one more, but one bad patient can ruin 10 for you. The responsibility is that it's not a small thing. Tomorrow you could be having a smoker walking into your clinic, and you could not be diagnosing the first stage of cancer in him. And I feel that is the biggest failure. So like I said, diagnosis is the key. If you're sitting in that chair and someone is submitting a part of their body to you and saying that, okay, heal me, treat me, let me know what is best for me, and you're not qualified to do it, please don't sit in that chair. The lessons that you learn when you get out of college, and the one that I actually learned was that even that little bit of knowledge, even that little bit of gyan that you're getting in college, which you're probably thinking, oh my god, I should have bunked this class, and this, I will not need it ever. But when you're actually sitting in your practice, you need every bit of the word that's come out of there, because that doctor phrase doesn't come easy. It comes with a lot of responsibility. So I feel that they should actually be passionate about it, or don't get into it. Don't just do it because you want that tag in front of your name, but do it with a lot of passion in you, and remember everything. Try and remember everything, because it's all valuable.